Thank you very much. We turn now to board committee feedback. I'm going to invite David to say a few words about the commissioning committee earlier this week. We don't have a written report, but David, we'd welcome some headline news if we may.
Thank you, yes, Malcolm, and there will be a written report, I think, at the next board. The commissioning committee was held on Tuesday. As ever, a broad range of areas discussed. We started with the management report from direct commissioning and looked at a range of activities, including Section 7A, etc. Perhaps one of the most important areas there is the proposed transfer to NHS England of the commissioning of healthcare within police custody, which is an area that I don't think anyone's been particularly sort of happy with where we have been. I'm pleased to report that there is a clear set of proposals that have been well bought into by all the various parties, and that the commissioning committee agreed that transfer should take place, subject to a bit of a wrangle about some money at the edges, which Paul is and crew are in the process of sorting out. But I think it's really important that gets done, and that we can bring much needed consistency and improvements to the healthcare provision to some people who need it. We then looked at the commissioning standards for out of hours support, including NHS 111 and the integration of 111 with the out of hours, out of hospital care. And this is a really good piece of work that has involved extensive consultation, collaboration, and sort of co-design with various interesting parties, including NHS clinical commissioners and many others. I think the team in Barbara's area have done a really good job actually in coming up with something that is essentially the front door into the urgent and emergency care reviews that and networks that Bruce talked about. We're now into the stage of now having got the commissioning standards approved and ready to go. We're now into the real work, which is how do we then start to bring this to fruition, which is all about collaboration and about working together locally to produce good, strong solutions. And we have good providers in place. We have a good solution, good set of standards, and I think this will make a very significant difference over time. We then moved to the annual assurance assessment of CCGs, which reflects the environment we're in, the challenges faced, but also reflects, I think, continued progress across the CCGs in building capability and in building their planning capabilities in particular. I'd also recognise that the standards are tougher, that we're also putting in place. And then finally, and perhaps in some respects as important as any of those together, is we have a regular programme of looking at the ongoing reviews on the various health improvement areas, in this case cancer, mental health and maternity. Cancer, where the report is in place and we're in implementation planning, there is new resource being brought to bear, and where I think the committee felt that good progress was being made, but we need to continue to keep real attention on how we take the 90 plus recommendations to prioritise those and to make sure that we get on and deliver the most important ones quickly without losing sight of the overall set of recommendations. Mental health and maternity was more an update on where the task forces had got to and when we were likely to see delivery and indeed the process of engagement between NHS England and those task forces, because we need to make sure that everything that is produced is both impactful and also deliverable, and that work is in good shape, and we will come back to those in due course, future committee meetings. My overall sense is significant amounts of work ongoing, broadly in the right areas, and with good traction and progress. And I'm really pleased to see really good collaboration with the CCGs and the various elements of the health system. Where that collaboration is in place, we get faster and better delivery. Where it's not, we don't. And I think that's an important lesson for all of us. Happy to take any questions.
Yes, any questions, comments for David? Paul?
Just one point of clarification. You've referred to wrangles around the funding of police custody. There aren't any wrangles at the moment. I think what you might be referring to is my natural finance director's vigilance that the agreements that have been reached around this particular thing get sustained all the way through to the money arriving as the service gets transferred to us. But I wouldn't like to give the board the impression there are kind of outstanding matters of that sort which we are currently struggling with.
And that's an entirely appropriate sort of putting me right, which thank you. My only rejoinder to that would be, it's really, and this is not really aimed at yourself, it's aimed at the broader audience, which is if that work is to come across and we're to make the improvements, the finances at the appropriate level have to come with it.
Indeed.
We have two other committee reports which are amongst the papers that you've got. One on investment committee. Moira, may we take the paper as read? May I invite any comments, questions on investment committee? No, thank you. Specialised services, Noel. Any comments you wish to make?
I hadn't planned to say very much at all, Malcolm, about this, so I'm happy to take it as read. The our work plan is established more or less for the rest of the year, and as you would have noted from the last time I spoke at the July board meeting, we issued our commissioning intentions for the year at the end of June, which were to do with our rare drug approvals and treatments. I'd only mention one thing that isn't fully captured in the report to the board, and that is that we are revising our approach to public engagement on specialised services. It had set a trend when we went through the consultation process and the feedback from the consultation process. We've learnt a lot from that, and the public engagement process itself is on our agenda to enhance as we go forward.
Thank you. Moira?
Perhaps Noel could tell us what ultra-orphan drugs are.
Ultra-orphan drugs.
Ultra-orphan drugs. Well, I might defer to my learned colleagues here, but okay.
They're for very, very rare disorders. So orphan are for rare disorders, and ultra-orphan are for very, very rare disorders, and they're the sorts of treatments that cost a very great deal to produce, but are actually only used in a very small number of patients, and therefore need specific ways of dealing with how we fund them.
Right. Thank you, Barbara, for that lucid explanation. Right, I think we're done on committee reports. Thank you very much. The next item is the annual general meeting, and it falls to me just to say a few words about this. To have an AGM is a formal expectation of a board such as this, and it gives us an opportunity to present our annual report and accounts. And again, thanks to Paul and so many other people right across the organisation for the efficiency and clarity with which those were produced this year. We're proposing to have the meeting of the board on the 21st of October. We're going to hold it in the Kia Oval in Kennington. It'll be a public meeting. But in addition to having the formal presentation of the annual report and accounts, we want to use this as an opportunity to engage with a much broader array of stakeholders, and particularly to dive much more deeply into what we've been doing over the past year in relation to the 5-year forward view, and to engage with vanguards and other actors in that process. So it's open to the public, and we would like to encourage as many people as possible to come and join with us in a discussion about what we've been doing, where we're going, who our partners are, and how we're working collaboratively across the piece. That's all I think I need to say about that. Are there any questions, comments on that? No. Right. Well, thank you very much. Then we move on to any other business. The Chief Executive has an item, and I have a couple of items.
Well, it was just, Malcolm, to
update the board on a few things that will land between now and our next public meeting, which is November 20th. So, picking up where Jane left off, she and colleagues will be publishing the Learning Disability Closure and Transformation Plan during October, so that will have landed by the time we're together on November 20th. It's likely that the Mental Health Task Force, chaired by Paul Farmer, will have produced its work by then. Talking to Julia Cumberledge and Cyril Chantner yesterday, I think the Maternity Task Force is more likely to be end of December rather than prior to that, but the substance of where they've got to seems to be making great progress. The work that Bruce has been doing on 7-day services and thinking about the feasible phasing of the clinical standards that will tackle the excess mortality in hospitals and weekends. I think the expectation is that we should be in a position to make announcements on that within the next couple of weeks. On the temporary staffing issue we've already talked about, we expect NHS-wide action on that very imminently. Winter resilience planning processes are in hand, and in the second half of October we expect to nail down what the line of sight is to what the SRGs are saying on that. And then finally, as we have previously discussed, there are a number of key appointments that we will be making to the organisation over the next 6 weeks or so, picking up where Karen left off in her report. A new leader on primary care, specialised commissioning, and on cancer services, and also the recruitment process now running in respect of the vacancies from Barbara and Tim, which I'm working closely with Ed on in terms of interdigitating the division of labour between our two organisations.
Thank you. If there are no other items of business, I just wish to record two. First of all, to report formally to the board that my term of office as chairman comes to an end in 5 weeks' time, but that I have been invited by the Secretary of State to serve a second term, and I have accepted that invitation. Secondly, to report to the board that this is the last meeting at which Ed Smith will be with us, who has served for the last 4 years, both as chair of our Audit and Risk Committee and also as our deputy chairman. I would wish the board to endorse my expression of appreciation for what he's done, and I can characterise Ed's contribution, I think, under about 4 heads. One is the expertise that he's brought from his vast background experience to the business of the board, and particularly to his chairmanship of Audit and Risk. Secondly, to his sheer professionalism in the way in which he has discharged his responsibilities as a member of this board. Thirdly, to his engagement right across the system, not just seeing his contribution as confined to this board, but how he engages with other parts of the NHS and our broader community of stakeholders. And finally, if I may, pay tribute to his enormous generosity and his values, which I think have been immensely powerful in supporting our team of national directors, and also have been a model to the rest of us as members of the board. So, Ed, we're not losing you entirely. We have retained an umbilical cord as Ed goes on to his chairmanship of the NHS Improvement. And I know that all of those values to which I've just referred will continue to be reflected in your responsibilities there, very much to our advantage as these organisations come together to work much more closely to overcome so many of the silos which can obstruct and pervert the way in which we would wish to discharge collectively our responsibilities in respect of the NHS. And may I say personally how much I look forward to continuing to work closely with you.
Thank you, and that's incredibly generous. I mean, can I actually, first of all, say, I think on behalf of the whole board, without any doubt, how delighted we are that you are going to do another 4 years as chairman of NHS England. I'm normally sad when I leave a board at the end of a term, but I can't actually say that I have that same sadness here, because I know we're going to be together for quite a long time into the future, locked in arms as we tackle the challenges and the opportunities ahead. So whilst I might not be physically around your public board meetings, I know I will be with you outside those board meetings, Malcolm, and I very much look forward to that. It's been an absolute privilege and a distinct pleasure to be here for the first 4 years of NHS England, and let's just go on and do what we need to do together.
And thank you, Ed, for all that you've done.
Right, that brings us to the end of the business this morning. May I thank all those who have joined us today, and thank all of my colleagues. I declare the meeting closed. Thank you.